Hey everyone, I'm Abby Sharp. Welcome to another edition of Fertility Files here at Abby's Kitchen. Now, you may remember that in some of my previous Fertility Files videos, we talked about my personal struggle with infertility and trying to get pregnant, and that one of the major issues that I had in my journey was that my uterine lining just didn't thicken, and that it was suggested that it was possible that my long-term use of the birth control pill may have played a role. I was on the pill for 14 years, before which I had a totally normal, regular cycle, but when I came off, I just never got a period. So based on your overwhelming interest in this topic, I wanted to dive deep into the research to find out what the literature said about the oral contraceptive use and long-term fertility. I also acknowledge that I am not a doctor, and I'm specifically not a reproductive endocrinologist or a gynecologist. So I am in no way giving you any advice at all on your own use of the birth control pill. I am, however, trained in analyzing research. So what I am planning to do today is to simply regurgitate my findings as unbiased as I possibly can, and to bring you some actual credible advice from some experts in this unique field. So I'm going to be joined by my reproductive endocrinologist, Dr. Tom Hannam from Hannam Fertility Clinic in Toronto, as well as Mama Dr. Jones, to get their take. Now, before we get into this, of course, I want to remind you that the information in this video is for educational and entertainment purposes only, and you should always speak to your doctor about your unique healthcare case. Okay, so let's kick things off by answering an important introductory question. How does the birth control pill even work? Now, the pill is an oral contraceptive that contains synthetic estrogen and progestin, similar to the hormones that naturally occur in a woman's body, in order to trick the body into suppressing ovulation. This takes place because the pituitary gland produces follicle-stimulating hormone, which is FSH, which in turn stimulates the production of estrogen and progesterone, which lastly encourages ovulation. Now, the synthetic hormones make the pituitary gland produce less FSH, suppressing normal ovulation. The birth control pill also does a couple other things to prevent unwanted pregnancy. The first is the thinning of the uterine lining. Now, a uterine lining of at least 8 millimeters in thickness is really important for maintaining pregnancy, as that is the lining that the fertilized embryo can nestle into for implantation. So to help prevent this from happening, the pill depletes glycogen stores to thin out the lining. The pill also may thicken cervical mucus to prevent the sperm from reaching any of the eggs. There's a lot going on in these teeny tiny little pills. Now, does the pill affect future fertility? If you speak to most doctors, most will advise you that after a few cycles post-pill, your body will return to its pre-pill state. In fact, a lot of the evidence on contraceptive use and fertility is actually quite reassuring. One study found that 96.8% of women got their period back within 3 months after coming off the pill. And another study found that after 1 year of pill use, 57% of women got pregnant after 3 months and 81% got pregnant after 12 months. There was even a study suggesting that the longer women were on the pill, up to 5 years, the greater their chances of conceiving. The rationale being that the extended hormonal exposure may confer a protective effect via minimalization of endometrial proliferation and menstrual shedding, which would help prevent endometriosis or endometrial dysfunction. However, we do know that not all women respond to medication the same. And a few studies, as well as a lot of anecdotal experiences, have found that there can be more significant delays in the return of your period and ovulation, which in turn may impact fertility. Now, research has found that the pill may disrupt normal menstrual function, but the length of this disruption is really what's up for debate. One study found major cycle disturbances after discontinuing oral contraceptives, including cycle length changes with more than 35 days in the luteal phase, or anovulatory cycles for up to 9 months after discontinuing the pill. Another prospective study on over 1,000 women who discontinued the pill because they wanted to conceive found that the percentage of women who had given birth after a year post-pill was about 32% for the pill, 39% for an IUD, and 54% for vaginal barrier methods. Interestingly, while IUD users did fare better than the pill users in the short term, the long-term use of the IUD seemed to really impact fertility, with only 28% of women who had used the IUD for 78 months or more getting pregnant and delivering, compared to 46% of short-term users. Another study compared pill users with non-hormonal diaphragm users and found that after 12 months, 70% of prior pill users had not yet given birth, compared with 46% of women who had used a diaphragm for contraception. The difference between groups did seem to disappear after about 42 months post-pill, but still, 3.5 years is a long time when you're desperately trying to conceive. Finally, another study evaluating a variety of contraceptive methods found that it took 25% of former pill users more than 13 months to conceive after coming off the pill, compared to 12% and 8.5% of women using IUDs and diaphragms, respectively. So the research in this area, as you can see, is clearly a mixed bag, with some studies finding no major differences in contraceptive rates between pill users and non-pill users, and others uncovering some sobering stats. It's very likely that different women respond differently to different drugs, and there are a few possible reasons why some women may experience this fertility delay. Number one, the pill's impact on uterine lining. First, let's revisit how the pill thins the uterine lining. Now, because it's ideal to have a thicker uterine lining here, probably about 8 to 14 millimeters when you're trying to conceive, the birth control pill is supposed to thin the uterine lining in hopes of preventing an unwanted pregnancy. The question, however, is how long it takes for a woman's uterine lining to begin to thicken again after discontinuing the pill, and how would this impact her future fertility? While research in this area is definitely in its infancy, one study conducted in 2012 found that long-term birth control pill use, about 5 years or more, can potentially limit the growth of the endometrial lining, aka the uterine lining. The study looked at 138 patients and found that those who had a uterine lining thickness of 7 millimeters or thicker had a mean use of the birth control pill of 5.8 years, while those who had a thickness less than 7 millimeters had a mean use of 9.8 years. In other words, the longer you're on the pill, the potentially thinner the lining. Next, let's consider the pill's impact on cervical mucus. So another concern is the fact that the pill thickens the cervical mucus to prevent sperm from getting up there. Now, how long does this last after discontinuing the pill? Unfortunately, not a whole lot of research has been done on this topic. However, one study claimed that after discontinuation, menstrual biomarkers such as length, intensity, mucus score, and ovulation were disturbed for about 2 cycles. After the 2 cycles, the biomarkers researched seemed to start to regulate themselves given some time. Now, the third is the pill's impact on AMH levels. Now, it's very common for women who are trying to conceive to get their anti-Müllerian hormone levels, aka AMH, tested to get an idea of their overall fertility status. AMH is used to check a woman's ability to produce eggs that can be then fertilized for pregnancy, where a higher AMH is related to better chances of conception. One study found that after 9 weeks of using oral contraceptives, AMH levels decreased in all women tested. In another study of 244 women that used oral contraceptives, their AMH levels were 19% lower than women who didn't use them. Lastly, in another study, 228 women who used the pill had AMH levels lower than women who didn't use it by almost a third. Having said that, there have also been a number of studies that state the complete opposite, suggesting that the pill did not have any effect on women's AMH levels. Honestly, it's hard to say whether or not oral contraceptives lower AMH levels in all women, or how long it may take before they resume. But it makes sense to get tested a few months following discontinuation of the pill to get some accurate results. Now, finally, I want to talk about the pill's impact on ovarian aging. Now, a lot of women who struggle with fertility after being on the pill are possibly diagnosed with ovarian aging. Ovarian aging can make it really difficult to conceive due to the fact that the ovaries aren't receiving the nutrients that they need to develop and maintain a pregnancy. These nutrients include CoQ10, vitamin E, vitamin C, and selenium. In one study, it was found that women who were on the pill had lower levels of CoQ10 and vitamin E compared to women who were not on the pill. Another study found that the pill may also deplete nutrient levels of folic acid, vitamin B2, B6, B12, C, E, magnesium, selenium, and zinc. And most of these are key players in reproductive health. In fact, one study found that low levels of CoQ10 is a common association with infertility in women due to low mitochondrial activity in the ovarian oocytes. This can explain why women experience delays in fertility after being on the pill without actually having any pre-existing conditions. I also want to briefly touch on other female health implications of the birth control pill. Now, in over 54 epidemiological studies, over 150,000 women were studied, as well as the relationship between the birth control pill and breast cancer. Now, women who had taken oral contraceptives in the past had a 7% increase in the risk of breast cancer, while women who were currently taking oral contraceptives had a 24% increased risk. Another study found that women who had taken the pill for over 5 years had a 10% increased risk for cervical cancer, and any longer, it was about a 60% increased risk. One possible explanation for these findings is that the synthetic hormones found in the pill might increase the growth of these cancers by binding to their estrogen and/or progesterone receptors. While that's not also great news, you might be happy to know that other research has found that women who had taken the pill had a reduced risk of endometrial cancer, as the pill suppresses endometrial cell growth. It may also help reduce the risk of ovarian cancer by decreasing the amount of ovulations a woman experiences, which in turn decreases the exposure to naturally occurring female hormones. But if the pill isn't to blame for my infertility, then what exactly is? Now, there's no denying that the hormones in the pill may potentially impact short-term fertility, but there's also the possibility that some women are struggling with something else that was sneakily present even before they started the pill. It's very difficult to link post-pill amenorrhea directly to the pill always, due to the fact that about 1 to 2 women get diagnosed with amenorrhea after coming off the pill out of every 100. So while the pill may help regulate and manage PMS symptoms, it doesn't cure any pre-existing conditions if present. It only covers them up. So commonly masked conditions include PCOS, hypothalamic amenorrhea, and thyroid issues. And when masking a condition for a prolonged period of time, it can make it even more difficult to regain your period or your fertility once you come off the pill. So now that I have given you all the research that I could find, I wanted to loop in my reproductive endocrinologist, Dr. Tom Hannam from Hannam Clinic here in Toronto.
Okay, so first question for you.
Yes.
In your clinical experience, does the long-term use of the birth control pill impact women's chances of conception? And if so, in your experience, how does it do that?
The good news is for most women, using birth control like birth control pill is not going to be consequential to their future fertility. So women are positioned to be taking the pill, for example, comfortably. For many women, it actually makes for easier cycles and confident that their future selves will be able to achieve pregnancy afterwards. It's not true for everybody, but it is true for most people.
That is very reassuring, because I mean, for a lot of women, the birth control pill or any kind of contraceptive is so important in their lifestyle. So
right. So maybe someone might have started it a long time ago. Maybe as a teenager because of pain, for example, around menses, or just trying to control regularity, or of course for birth control. So for a lot of women, they've actually been on it for many years. Interesting, during this time of COVID, a lot of family doctor groups, chat groups are talking about how many women are extending their pill. So people who have been thinking about trying to achieve pregnancy, a lot of people are putting putting it off, taking the pill for a bit longer, or keeping their IUD in place for a little bit longer, just as they sort of watch and figure out how everything's going to settle out. So I could imagine there are a number of people who would be watching your channel, both on the pill right now and uncomfortable with the idea, not wanting to get pregnant in this moment, but very much hoping to be getting pregnant soon.
Very interesting. And so for those women who may be affected by the pill, what is going on there that may be causing those issues?
So the way the pill was designed was to be an estrogen, like your natural estrogen level. And naturally, when your body has lots of estrogen in the middle of the cycle, it doesn't stimulate any eggs to grow. So the idea behind the pill is just give a person lots of estrogen and there won't be any eggs growing, which is true. That's how it works. The thing is, it's the estrogen is not your natural estrogen, of course. It's called ethinyl estradiol. It's a synthetic estrogen. And it actually works differently for every woman, everyone's body. And it works differently for different parts of their body. So that's why, first of all, a lot of women have to find the right pill for them, just to try to find the right dose that works for them, that makes them feel kind of normal. But even then, it's never exactly normal. It's never exactly what it would be naturally like for them with natural estrogen levels. These estrogens actually, interestingly, they work as positive estrogens in some places and negative estrogens in others. It's weird. It's the way it binds to receptors. So for many women, it will, for example, take away hot flashes. If a woman had a really naturally low estrogen level, takes the pill, she'd feel better. That's a good thing. Might help with bone density in similar ways. But at the lining of the uterus, for many women, it actually acts as an anti-estrogen. So the way she experiences that is having very light menses or no menses at all. So a lot of people watching this will be able to recognize that. They'll be like, yeah, when they're taking the pill, they'll have lighter menses than usual. That actually can be, for some, that's a feature, not a bug. Mm-hmm. So for example, we were talking about pain. For some women, they're taking the pill because of pain, perhaps related to endometriosis. So having lower estrogen activity at the uterus is actually a great thing. And for many women, having a 2 or 3 day menses or 1 to 2 day menses might be preferable to having a heavy 4 to 7 day flow. So there's value to it for some, but we have to acknowledge that those women who are having lighter menses are having less estrogenic activity to the uterus while they're taking the pill.
Right. That does totally make sense. And do you see the same outcomes when we are comparing different forms of contraception, like IUD, NuvaRing, birth control pill? I'm sure a lot of my followers are going to wonder if one is more safe than the others when it comes to fertility.
So I don't have specific studies to reference when I'm talking about the safety of each of those 3 things. Mm-hmm. It just comes down to personal experience, my personal experience. I think the NuvaRing is effectively a little bit more anti-estrogenic than the birth control pill. And the IUD is different for everybody, but for most women will have very light or no menses indeed with the IUD.
Okay. And so is that a good indicator of the estrogenic activity?
Yes, it is.
Okay. Good to know. And why may some women be affected by the pill, but others can go off the pill, and then they conceive like the next month?
Right. In fact, for some women, it actually enhances the chances of conception.
Right.
Why do I keep bringing up endometriosis? But women with endometriosis, it's a disease where where estrogen really inflames the condition. It can even lead to blocked or compromised fallopian tubes, maybe even compromised implantation when they're on the pill. It takes a lot of that activity away. Perhaps their best chances for pregnancy fall immediately the month after stopping the pill when their cycles come back. Some women with polycystic ovary, that means they have so many eggs they don't ovulate regularly. They're on the pill, nice regular cycles. And sometimes they stop the pill just for a couple of months to actually get some regular cycles. There are definitely people out there who really, the moment they stop the pill, do achieve pregnancy. So if that's what you want, that's a good thing.
Right.
Just one has to be careful. That's all.
Of course. Yeah. And what would be your advice for women who are on some kind of contraceptive and may want to get pregnant soon, maybe after this whole COVID thing? When should they plan to get off of that contraceptive?
So the good news is for many women, they're going to stop the pill and be able to get pregnant right away. There's a subset of women who won't have that experience though, which would be unnerving if that was their goal, to be able to achieve pregnancy. They can know that's happening to them if they stop the pill and nothing happens. So what do I mean by nothing happens? For some women, they just don't ovulate for a little while. That's actually relatively common. How can you know if you're ovulating? A couple of different ways. You could use an app like Clue, for example. Lots of good brands out there. Another thing a person could do is follow those sticks at home, those LH detection kits. So Clear Blue, Clear Plan. I'm sorry, I don't remember the name. Yeah. But even the dollar store varieties, just pee on a stick every couple of days. Cheaper sticks may be better because the money starts to bug you after a while. But the point is, you'll get a little surge that tells you that you're ovulating, and just after a person stops the pill, for some women, it does take a little while for that moment to kick in. So it's not inherently problematic for 1 or even 2 months of no regular ovulation after stopping the pill. If it's been more than 1 or 2 months, though, there's an issue. It's called post-pill amenorrhea. The pharma companies don't really endorse the concept. They don't think it's really real. Most physicians do. It's hard to say in an individual's case if it's just exposing this individual's underlying tendency to not ovulate, or if it was secondary to the birth control.
Right. Yeah. That there is so many confounders there. So.
Yeah, so many confounders. But it might be reasonable if someone is looking to achieve pregnancy to predate stopping the pill by a month or two, maybe a little earlier than they had thought they wanted to actually conceive.
That makes sense. And is there anything that women can do to get their cycle back quicker once they come off birth control? Is there anything that we can kind of incorporate into our lifestyle?
So there's a lot of things that can be related to not having a cycle when you're off the pill that actually didn't have anything to do with the pill. It might just be exposing an underlying tendency. So it's very reasonable to look at lifestyle. We are in a time of great stress right now. Stress is absolutely associated with amenorrhea. If you're not ovulating regularly, it might be because of some serious impacts that are happening in your life at that moment. It's very situational. You might decide that you need to look for some online counseling or other help, but it might also be a reasonable reaction to a temporary situation that's going to relieve. Other people are struggling with sleep for the same reasons. Right. Sometimes people's cycles, they start to become irregular because of other hormone imbalances, like being hypothyroid, for example. It's relatively easy to test that. You might be able to do a virtual consult with your family doctor, go to a community lab with a mask on and get a blood test. Just make sure your thyroid's in balance. Another thing it can be is just around a person's own individual lifestyle. Look at us all stuck at home right now. Some of us might be exercising too much. I suspect a lot of us are not exercising enough. And some of us, because of stress, might be stressed not eating. That's not everybody. A lot of people are stressed eating. And so weight can make a real difference to this, both being underweight, very clear if your BMI is less than 17 and a half, but also being overweight. Now, it's not true for everybody. As BMI increases, that doesn't inevitably mean that your cycle will get irregular. If you are overweight right now, that doesn't mean that just because you lose weight, your cycle is going to become regular. But if you go to a doctor, one of the first things they're going to say is, if you can, control your lifestyle to control your weight into a reassuring range, and you'll be more likely to ovulate regularly. For many women, they might be able to individualize that. They might be able to look back at a time in life when they were ovulating regularly and try to make sure that that's the weight that they're at right now. That's the amount of exercise they're doing right now. Maybe that's a way to personalize your lifestyle to know that you've done the right thing for you, for your body, because everyone's different.
Absolutely. Okay. I think that is fantastic advice for so many women who are watching. So thank you so much, Dr. Hannam. I, of course, will be leaving links below to the Hannam website if anyone's interested in getting some more information on fertility treatments from one of the top fertility clinics, as far as I'm concerned. So
thank you. Very kind of you to say. And for anybody who's been watching this far, that what they might realize, what they want more than anything is lifestyle, even dietary advice. I'm not going to claim to be the best person for that, but we work with some really great naturopaths. It is that's the type of thing that can really help, especially during this time while we're all stuck at home. You can get some individualized advice, so you're not just doing a deep dive down the internet. That's a tough place for anybody.
I agree. Okay, thank you again so much. Have a great day.
So nice to see you again.
You too.
Thank you again, Dr. Hannam. I will definitely be leaving some links below to Hannam's website if you're interested in some more information on fertility treatments from one of the top fertility clinics. Now, I also want to loop in a fellow evidence-based health YouTuber, Mama Dr. Jones. So, Dr. Jones, thank you so much for joining me.
Thank you. I'm happy to be here and chat with you guys.
So as an OBGYN, how long would you encourage women to wait after they do come off of some kind of birth control before they start worrying about needing to see a fertility specialist if they're not getting their period back?
We do know that the average time to resume having periods after coming off a birth control pill is right at a month, but that means that some people resume periods sooner than that, and some people take a lot longer. So 90 days is probably the top limit of where I would say, I need you to call me and let me know if we haven't started a period by this point so that we can look into it. As far as when should you see a fertility specialist, I think it kind of depends on your OBGYN. I personally do a good amount of infertility evaluation and treatment, and a lot of generalist OBGYNs do that. So I would prefer for my patients to come in and see me so that we can kind of start that initial workup. And then if it's something that we can't take care of in my clinic, then we'll send you on to an infertility specialist.
Okay, that makes amazing sense. And I think that's really helpful information for a lot of women who are just unsure.
People know before they went on birth control pills that their periods were very irregular, and they went on birth control pills to have a little bit more predictability in their cycles. I would tell that patient, you should expect your periods to go back to being irregular when you get off of your birth control pill. I still want you to be in communication with me if that happens, but it won't be surprising.
Yeah, that's a really good point, because I think the birth control pill can mask a lot of these kinds of irregularities when it comes to one cycle. So it's good to be aware that it's not necessarily because of the pill, it's because maybe something was already present before you went on the pill. So that's a really good point as well. Now, do you ever hear concerns from any of your patients in your clinic about using the birth control pill and having fertility issues down the road?
Yeah, I think that that's a really common question and concern that people have. And for me, the easiest way to explain it is that a single percentage of the population is going to have infertility issues when they go to attempt pregnancy. And when we look at people who have been on a birth control pill, you have what we call recall bias. You want to have something to blame it on. And when you come off the pill and you have infertility that ends up requiring treatment, it's really convenient if we can say, oh, the birth control pill caused that. Unfortunately, what we see is that it's not usually that easy, and we don't always know what causes it. But if we look at groups of people who've been on birth control pills and who've never been on birth control pills, the risk of infertility between those two groups is very similar, if not exactly the same. And so this, amongst hundreds of other studies, is the reason that we say it does not affect your long-term fertility. It is true to say that you may have a delay in return to ovulation. And like we just talked about, for most people, that's about a month. For some people, it can be up to 3 months, but it shouldn't cause actual infertility. It may just be that you need to come off, but I usually counsel my patients, come off your birth control pill when, if you got pregnant the month you came off, it would be okay, but not when you have to get pregnant the month you come off. Give yourself some time and some flexibility, because we can't always plan these things.
No, even if there is no issues with the birth control pill, it can take women many months and many cycles to conceive. So it's always good to plan for a little buffer in there. So yeah, that's really good advice. Now, of course, I want to make it clear that I am all for reproductive choice and options, but in your experience, are some birth control methods less likely to cause this delay in, getting that cycle back in ovulation, or is it highly individual? So I'm talking about the pill versus IUDs versus, Nuva rings, all those kinds of different options.
So it's going to be very individual between the types. Obviously, if you're not on something that is hormonal, then you shouldn't have that delay. So if you're only using natural family planning or you're only using condoms, then you shouldn't experience that. But anything you're using that affects your hormones or that includes hormones, and even sometimes the copper IUD as well, you're going to see that in some people it has no effect, and in some people it has delayed ovulation effects. As far as pill versus patch versus NuvaRing, these three are all the same medication, just in a different delivery form. So those three should be really similar amongst people, how you as an individual react to it should be the same between those 2 or 3. For the Depo-Provera shot, this can be much more unpredictable. And resumption of ovulation when you've been on the shot can be extremely long time. So if someone comes in and says, I don't want to get pregnant this year, but I think we're going to start trying, March of next year, I usually would recommend to them, let's not do the Depo shot, because it may be that you have a really delayed interval to achieving pregnancy with that. For the IUD, I would usually tell people to have it taken out kind of the same as the pill, give yourself 6 months to go back to normal periods, but know that there's a really good chance you'll be in the majority of people who are able to get pregnant far earlier than 6 months out.
Yeah, that's really good advice. So, surprises can happen. So just be ready for that, I suppose.
Absolutely.
And is there a specific product that you in your practice kind of gravitate towards most when it comes to all of those different options?
As far as what type of birth control I recommend?
Yeah.
People always ask me, I think the most common question when someone comes in to talk about birth control with me is, what's the best one? What do you recommend?
Right.
And I have none. I have a chart. I think I've gone through it on my channel at one point that comes from bedsider.org. It goes over all of the pregnancy risks and different tiers of birth control, from over-the-counter options to pills, patches, rings, shots, to IUDs and Nexplanon. I don't think there's a better or worse option. I think it's very individual. So like I was saying, if you think a year down the road you may want to try to get pregnant, then Depo-Provera may not be the best option. But if you think it's going to be 3 or 5 years and you want to use the Depo shot, I think that's a really great option for some people.
Amazing. Well, thank you so much for all of your incredible insight and your amazing content. If you're not already following Mama Dr. Jones, everyone, you've got to hit up this channel. I think if you are a fan of my kind of evidence-based content, you're going to love this amazing content, especially as it pertains to women's health. So I'm going to leave some links below to her channel. So thank you again for joining us.
Thank you so much.
Thank you, Mama Dr. Jones. Of course, if you're not already following this woman, you definitely need to. I think if you love my evidence-based approach, you are going to love hers as well, especially as it pertains to women's health. So, of course, I'm going to leave some links below to her channel, and definitely you're going to want to subscribe. Now, bottom line, folks, it's difficult to pinpoint an exact cause of infertility post-pill. Again, there still needs to be further, more extensive research done to explain why some women struggle to get pregnant after coming off the pill, while others can just have sex the first month and get pregnant. Until then, my recommendation is to speak to your doctor about getting a referral to a fertility clinic as soon as you feel that you might be struggling. The sooner that you can get some answers, the sooner that you can get an action plan in place to help you conceive in good time. Well, folks, that is all for me today. If you like this video, please be sure to give it the thumbs up. Leave me a comment below with your experience with the pill, or really any questions that you may want me to cover and investigate as part of this Fertility Files series. Subscribe to the channel, and I will see you next time on Abby's Kitchen. Bye!